how long does a dressing need to be on the mole for? Okay. Um, well, my dressing regime is the same, whether it's a mole removal, a tummy tuck, a breast augmentation, a circumferential abdominoplasty, big ops or small ops, it's a week. So broadly speaking, my dressing protocol is a week for all dressings, and people come. Well, you don't have to come back if you've got if you've got dissolvable sutures, you can do it yourself. So a week. Now you've got to ask yourself, what's the dressing doing? Because on the face, I don't use a dressing at all, and basically what the dressing's doing usually is kind of protecting your clothes because it bleeds a bit. Certainly the first day it bleeds a bit, so you just don't want it bleeding on your clothes, and your shirt sticks to your wound. Wouldn't be great. So it's just acting that sort of barrier there. So after a couple of days, you could potentially not have your dressing, although you may not want clothes and what have you rubbing against the wound while it's healing, because as I say, it takes 5 to 7 days for the skin to heal. So you probably want the skin healed if you're having clothes and what have you around it. So a week is the norm for dressings on the body, but as I say, the face doesn't have the dressing at all, and you can just wash and shower normally. And the reason for the dressing is first of all not to mess up your clothes, and secondly not to get little sort of fibers from your clothes and what have you into the dressing. So yeah, you don't have to kind of worry about it too much. If it kind of falls off after 4 or 5 days, it might be okay. It might have done its job, but you can always send us a photo and say, look, what's going on. But a week is a standard, just because it's kind of easy. The dressing clinic normally is a week after your op, is kind of the standard regime we have.